This week on the BackTable podcast.
In a way, I saw that as an opportunity to do a little bit of advertising about our specialty and about what we can do. And I think in a way, the company was also very interested about my background. To be honest, I'm not sure if there are many interventional radiologists in pharma clinical development. I haven't met any so far. So in a way, I think they were a bit intrigued about me and where did I come from and why I was looking for a role in clinical development. But also they saw the fact that, interventional radiologists bring a lot on the table because we're not internists, we're not ICU, physicians, but we have a lot of experience when it comes to treating people, doing invasive procedures, and also we know a lot about pathology and we know a lot about imaging. So we have a set of skills that is quite unique because where medicine, surgery, and radiology overlap.
Hello, everyone, and welcome to the BackTable podcast, your source for all things interventional and endovascular. You can find all previous episodes of our podcast on iTunes, Spotify, and on BackTable.com. Now, a brief message from our sponsor. RADPAD was developed by physicians for physicians. Clinically proven radiation protection during cine and digital subtraction angiography. Don't bet your career or your health on anything less. Trust RADPAD radiation protection shields for all your fluoro-guided interventions. See radpad.com for more information and contact info@radpad.com for a free radiation evaluation and a no-brainer radiation protection cap. And don't forget to tell them that you heard about it on the BackTable podcast. Now, back to the episode. Today we have a great episode. I'm going to talk about working with and or for industry partners. We've done prior similar episodes on this topic. For example, we had Atul Gupta, who previously came on the show, talked about innovating alongside industry, acting as a CMO. Everybody knows that he's with Philips. That was episode 128, if anybody wants to check that out. Today, we are going to talk a little bit more about industry as a career path for docs. And I'm joined with longtime friend of the show, Dr. Greg Makris. Greg, did I pronounce your name right this time?
Great, yeah. Great Greek accent.
And Greg was previously on episode 57, which goes way back, man.
Yeah,
Pre-100.
Just before the pandemic, actually, I remember.
Yeah, I know. That's
just
wild.
Just a couple of months before the first lockdown.
I can't believe we existed before the pandemic. I can't even remember that far back. It's wild. And I remember you coming on the show. That was also around the time when we started sending microphones to people, I think. Because you took a picture.
I had a microphone. Unfortunately, it didn't work back then.
Yeah, right. Yeah. But you took a picture with it and posted it, which was also something new. Yeah, which was great. It's a great touch, and we love that because that was around the time when we were starting to get some traction, and when people were posting with our hoodies on and stuff like that, we really loved it. So
I still have the hoodie. Love the hoodie.
Yeah.
Everybody keeps
comfy, man.
Everybody keeps asking me at the gym, what is BackTable? What is BackTable? I'm like,
yeah, right.
Okay, just have a seat. I'll tell you all about it.
That's right. So Greg and I have kept in touch over the years. You've done work with Road to IR, and you and I got to sit down at. I haven't done any Road to IR missions. We're going to talk about that a little bit today, but you and I got to meet at the recent CIRSE in Barcelona, and we got to sit down alongside Venkat Tumla, who also is working with industry and made a shift in his career over the last few years. And the three of us got to kind of chat about what we've been up to, and it was great to catch up with you. And that's one of the reasons I wanted to have you on the show is to talk about that transition, because we're definitely seeing more people, especially even in academics, I think in the US, doing more kind of like, whether they be passion projects or working with industry, because they realize there's a career pathway here that it's not strictly research, it's not strictly clinical. It's gives docs the chance to have input on, industry devices, innovating. And so I wanted to pick your brain for the audience so that, people can get an idea what that side is like, right? And so we'll dive into it. But first, for those who aren't familiar with you, Greg, can you just tell us a little bit about where you trained, how long you've been out, and where you are now?
Yeah, of course. To start with, thank you very much again for the invitation. As always, it's a great pleasure to be on BackTable and to have a chat with you. Yeah, I mean, it's amazing that last time I was on this seat again, it was 3 years ago before COVID, but time flies, as you said. And so I'm an vascular interventional radiologist. I'm Greek. So I did my medical degree in Athens and then moved to London to do my PhD in vascular surgery at Imperial College, and then did my radiology training in Cambridge and interventional radiology fellowship in Oxford. And for the last few years, I've been working as an attending at Guy's and St Thomas Hospital in London. And for the last year, I'm an honorary attending and a director and global clinical lead in the vascular therapeutic area of Bayer Pharmaceuticals. Yeah, it has been an interesting journey so far. And as you said, I see more and more colleagues getting interested in, exploring other options. And,
Right.
I don't think that's a bad thing. Actually, I think that's a great thing. It's a great thing from a personal point of view, but also for the specialty. And, 10 years ago or 15 years ago, if you were, asking me if I could see myself doing something like that, I would probably say, no way, no chance. And also things were very different 10 to 15 years ago. I think doctors were far more discouraged from pursuing opportunities like this, simply because there was, and in a way, a narrow-mindedness around this. There was a fear that, we're going to lose the soul, we're going to lose our soul, or we're going to join the dark side, or, there are various dark ways of putting these other experiences. But, in reality, I think that we only have to, win things. We can only win things from these experiences. And obviously, it's not something that's for everybody. It's not something that, it's a decision that you have to make after you have, after you have done some research around this and after you have experienced a few things. And you have to be honest with yourself, and you have to be honest with, with yourself about what you want to do, what makes you happy, where you see yourself, in the years to come. Because obviously things change, okay? I mean, as people, we also change, and the things that makes us happy also change. So, it's important to keep that in mind.
Yeah, very, very true. And so you're still doing some clinical work though, right? You still do part-time clinical. Yeah, which is good. And Atul mentioned that when he was on the show, because he still does, I think, I think it's something like 1 week a month clinical work, which is good to keep in touch with your peers, your clinician peers, so that you kind of have that relatability when whether it be you're part of a product launch or you're trying to communicate something to physicians. I could see where being out of the game, could kind of, you could lose that a bit, and I think that's what people get worried about. And so I'd like to know, kind of like, was there a catalyst before we get into some of that stuff? Was there a catalyst for making the switch, or was it just the opportunity kind of fell in your lap and you're like, oh, this sounds like a unique challenge. I'm going to try this.
It was a bit of both, I think. So for quite a few years, I think towards the end of my specialty training, I started thinking, okay, where do I want to go with this? Where do I want my career to go? And, during my involvement with CERSI and my participation in the European Trainee Forum and, some projects we ran through that forum, which was very, very useful for me, I had the opportunity to come into direct contact with the industry and start working with them and seeing in more detail what they are doing. And that made me start thinking a little bit about it. So, until that point, I was seeing my career as someone who was going to become a good clinician, but mostly an academic. Someone who would be doing like 1 or 2 days a week or 3 days a week of clinic and operating, and then the rest would be research. But after I had these experiences and after I had these interactions with the industry and I could see what they were doing and what they could bring to the table, then I started thinking, okay, that's another very interesting area. That's another interesting area where I could see myself developing into. And so this, I was thinking about this. And as I was saying before, this doesn't happen in one day. This is a process. And I think you start thinking about this and, you sleep on it and you keep thinking about it for a few years. And then there was an opportunity that came up a year and a half ago in Bayer. And until that point, I was thinking that probably, that opportunity was going to be in medical devices. But as life is very unexpected and unpredictable, this opportunity came up in pharmaceuticals, which is,
Right.
very, very different to medical devices. And, this opportunity was, in a way, exactly what I was looking for. So it was a global role. It was a role in a great company, a role that was mostly on clinical development and research and development, which is what I was mostly interested in. Because the other thing that you have to understand as a physician who is looking into the industry is that there are many roles, there are many hats that you can wear if you want to join the industry, and you have to pick that hat that's more appropriate for you. So there is the medical affairs hat, there is the commercial hat, there is the clinical development hat. For me, and because of my academic background, my interest in research, this kind of the research and development and the clinical development side of things was what was mostly interested. And it happened that at that point, the guys in Bayer and in the vascular division, they were looking for someone to lead on that role. So I was like, okay. So I interviewed with the team. I got to know the team very well, and it was a great team. There were some really nice people, really knowledgeable people, and I thought, okay, I can see myself in that group. And most importantly, I can see myself learning from this group and developing within that group. Because, after working as a couple of years as an attending, I mean, I know it doesn't sound like a lot, but through the COVID years, it was the 2 years during the COVID, it felt like a lot more than just
like 10 years.
Yeah. I caught myself thinking, okay, is this something that I want to do for the next 20, 30 years of my life? And in all honesty, the answer to that was probably no. And, when this opportunity came up, I was like, okay, this is probably something that I could, I could see myself doing. It's something that allows me to continue growing, because at that point I felt like, okay, I have reached a plateau now. I've reached a plateau of learning, of training, and I sort of felt like I need a new challenge now.
Yeah.
And I thought that opportunity was giving me that challenge.
So did this start out as consulting work and then evolved
No.
because of those relationships you made? No. So this was something completely different.
Yeah, it was completely from the start.
Yeah.
That's a funny thing. I had very good relationships with many other, companies, and I've worked with some of them for various projects, and that's why I was always thinking that probably it's going to be, I'm going to be a bit more involved in one of these roles with one of these companies in medical devices. Because, as interventional radiologists, we are mostly working with devices. We don't really work that much with drugs. Of course, this doesn't mean that we don't know how to use them, right? Or we don't know how to do research on them. So, when this opportunity came up, I thought, okay, that's not what I was expecting, but it's actually quite interesting. And from, when you compare the pharmaceutical side of research, the pharmaceutical side and the medical devices side, when it comes to research size and, budgets and impact, the pharma side is far, far bigger, obviously. So I saw that as a challenge. I saw that, okay, it might not be exactly 100% what I know, but it's definitely something, I've done a PhD, I've done lots of research, so I know how to do research. And I know that in vascular, I can definitely contribute in the development side for a number of drugs like thrombolytics, like anticoagulation drugs, and so on, the drugs that we have experience. And, obviously, when you are, honest, you have to be honest with yourself, and you have to be honest with, your team, and you have to be honest about what you're good at and what you need help with. And as with everything else, when you join a new role, you have to be open to, learning, developing, getting new skills. And for me, that's part of the experience that I was looking for.
Yeah, it sounds like, to go back to what you were saying about, you don't typically think of IRs as really terribly knowledgeable about pharmaceuticals, because it's a limited, number of pharmaceuticals that we interact with, right? Thrombolytics being probably some of the main ones that we do use on a regular basis. But cardiologists, for example, you'd think have a better relationship.
Cardiologists dominate.
Yeah.
Cardiologists dominate.
In pharmaceuticals. Yeah, exactly.
So for my team, I think that, 50% are cardiologists.
Yeah. And they're probably looking at you like, where'd you come from?
Yeah, no, exactly. And, in a way, I saw that as an opportunity to, do a little bit of advertising about our specialty and about what we can do. And I think in a way, the company was also very interested about my background, because it was to be honest, I'm not sure if there are many interventional radiologists in pharma clinical development. I haven't met any so far. So in a way, that I think they were a bit intrigued about me and where did I come from and why I was looking for a role in clinical development. But also they saw the fact that, interventional radiologists bring a lot on the table, because we might not have, we're not internists, we're not ICU, physicians, but we have a lot of experience when it comes to treating people, doing invasive procedures. And also we know a lot about pathology and we know a lot about imaging.
Yeah.
So we have a set of skills that is quite unique.
Yeah.
I would say, because we are where medicine, surgery, and radiology overlap, if you want. And there are not many specialties that can do that. Cardiologists are very dominant in this field exactly for this reason, because when it comes to cardiovascular, they are also in this overlap of, because now they're also doing invasive procedures. They're very good with, the internal medicine stuff. So I think that, interventional radiology perfectly plays to be in these roles, in these positions. And the more time I spend with the team and the more time I spend, working on projects, the more I see that my background in radiology and my background in interventional radiology actually helps me a lot to understand certain concepts that other specialties might find a little bit more difficult to grasp.
That's super interesting. I wonder, I could see myself or our audience saying, well, Greg, you have a PhD in vascular, medicine, and so that probably helped prepare you for this role. But what would you say to that? Does the PhD really give you that much of an advantage, or would you say it's more your clinical experience?
Well, again, it comes down to what type of role you're looking into getting into in industry. So, for example, if you're looking into a role like mine, which is in clinical development that has to do with designing late-stage trials, analyzing results, doing all these kind of things, then you need to have some sort of research background. It doesn't have to be a PhD necessarily. I mean, it definitely helps, but research is not something that you can be. I mean, you can get trained, but in a way, you learn how to do it. It takes time. It takes time, and you learn how to do it by writing papers, doing studies, writing protocols. And, you always start small and you build bigger and you work in bigger projects and so on. So I don't think you necessarily need a PhD, but you definitely need to have a research background on this. However, if you don't have this research background, but you're still interested in, doing work for the pharmaceutical industry or the medical device industry, then, as I was saying before, there are other roles in medical affairs or in commercial roles or health economics roles. So you have to, the clinical side, your clinical knowledge will always be very, very important. And increasingly, I think the industry realizes that they need experienced doctors to help them make the right decisions, because we understand the market, we understand the patients, we understand our colleagues better.
Yeah.
So even if you don't have research in your background, you can look for roles in medical affairs, you can look for roles in commercial, and so on. And always the best thing to do is just talk to people who have done this. So until today, I've had quite a few calls with friends who were interested and wanted to find more about my role, what exactly I'm doing, what I'm not doing. They had questions that I had before I started. And unfortunately, some of these questions, you cannot find the answers on the internet. You have to actually speak to people who are doing this. And, you can find people on LinkedIn, or you can easily just ask me or anybody else who is doing this to bring you in touch with the right person for the right role.
Yeah, and that's exactly right there why I wanted to have you on the show. Is I think there are a lot of people out there who have questions like these. Like, even in my wife's specialty in ENT, she's seeing a lot of people inquiring about other options that aren't pure clinical. Because, like you said, I mean, whether it's a post-COVID phenomenon or it's just these are the times we live in, I think everybody's looking for a different kind of balance. It's not just pure clinical work that might provide satisfaction in multiple ways, right? Nobody's saying, I haven't heard anybody say, I want to completely give up clinical work. It's more just like, hey, I want to find a way to use my experience and know-how in a different way, right? And like you said, to challenge my brain in a bit of a different way, learn something
exactly.
new,
I mean, the way I see this, I haven't... apart from the fact that I'm still doing 1 day a week at the hospital, I don't see myself as, having left the medical profession.
Yeah.
Because still what I'm doing and what we're doing as a team in Bayer is we're trying to develop drugs that are going to help people, going to help patients. And for me, this is what doctors do. They help patients. I mean, you help them from a different capacity.
Angle. Yeah.
From a different angle. But the essence is the same. And as you said, you just have to find that angle that makes you happy as well. Because, if you're not happy, if you burn out, if you're miserable at work and you don't get stimulated or you don't get the work-life balance that you need, then that's not going to work at the end of the day for you and for your patients. So it's very important to, you have to be honest with yourself at the end of the day. And you have to realize, okay, what do I want to do? Where do I want to be?
Yeah, and I know some people, and I've talked to people because I made a transition to doing more full-time BackTable kind of part-time clinical work, and the questions I get a lot is like, well, aren't you worried about losing your skill set? And aren't you? I mean, that's kind of the main one. That's the thing that, because my wife did a bit of a sabbatical, that's what she's worried about, and I think that we're all worried about because we spent so much time and energy on training. That's that's the common question. I feel like I found a nice cadence of clinical work that makes me feel like I'm still involved, like you said, but I'm also not. It doesn't overwhelm me, and it allows me to focus on the main passion, which is BackTable. What do you have to say about like finding that cadence, finding that whether it's 1 day a week, 2 days a week, 3 days a week? Give us a little bit more insight on your day-to-day and how you came up with that formula.
Yeah. So, it is a risk. I mean, there's no doubt about that. And sometimes you have to make decisions and you have to take some risk, but as long as it's calculated risk and as long as you know what you're doing this, then I think you should be fine. For me, before I get the role, I was very clear with the company that I would like to have at least half a day or a day every week. Okay, depending on how busy I am so if we have a submission or if we have a trial that needs something urgent or if I have travel, then obviously, I can't do that week. Okay. But as long as you have this flexibility, and usually most companies are happy to provide you with that flexibility, as long as they recognize that what you're bringing on the table is very important. And very often, they really want to get like doctors who know what they're talking about. They really want to have people who care about what they do. And when they find you and when they realize that you can actually help them, then they try to be flexible. And, nowadays with COVID and with virtual working, things have changed a lot. And, many, many people still work from home most of the time. I mean, because my team is spread around the world, most of the time I have to, if I have a computer, then I can work from wherever I am.
Yeah. So
that allows me to be quite flexible with my routine every week. Every week is very different, to be honest with you, and depends on, what are my responsibilities and my commitments with the company, and what are my commitments with the hospital. Some weeks, my commitments with the industry might not allow me to have that 1 day. Some other times might allow me to do a little bit more. So as long as you have good planning skills and as long as you can, be a little bit flexible with your routine, then usually you can make this work. And obviously, now when I go to the hospital, I'm not gonna do the most complex stuff. I'm not gonna do the complex stuff that I used to do, a year or 2 years ago. But I think that if you can manage to maintain that 1 day a week, 1 day every 2 weeks, then I think you can maintain a reasonable amount of skills and a reasonable level of skill to be a safe practitioner. And of course, you have to keep up with all the other, mandatory trainings that you have to do at your hospital. And that's obviously, extra work that you have to do. But even, you can all do that online. I mean, you can all do the training online. You can even do your diagnostic reporting online. You can do this from home these days. So, the way things have changed after COVID with all this, virtual working has helped a lot with combining these two lives, if you want. So I think it's definitely possible. Obviously, as you move ahead and as you become more busy and you become more senior in a role and you get more and more responsibilities, then you might have to drop something. Okay, and you have to be realistic about this, because at some point there will be a time that you have to make a decision. If you get a promotion or if you have started leading more and more people, then you'll have to drop something. Yes. You can, as we know, you can't have everything in life. However, I have met very senior people in the company who are still doing 1 day a week, despite being in a very senior position. And this means that, they might have one less day in the weekend to, see family time. But what I'm trying to say is that everything is possible. You can combine. Most companies now, they try to attract talent by offering this kind of, flexibility.
Right, hybrid sort of thing.
Yeah.
Yeah.
So
yeah, I mean, it is possible. I mean, it seems so. Yeah, I mean, it seems to make sense though for them to.
Oh yeah.
Because they want you to stay relatable, right? They want you to still bring that clinical insight.
Yeah.
So they should carve out that time for you. You know what I mean?
The way I see it is that it's a win-win for both of us. It's a win for me because I keep my skills, but it's also a win for the company because I keep my clinical experience up to date. I keep my networks relevant, which is very important for the company and for me. And also I keep my clinical thinking active, which is also very interesting, because that's why a company hires you, to bring the clinical experience and bring this clinical instinct that you have. If you stay away from the hospital for too long, then you're losing this capacity.
Right. And, so I guess the tricky part might actually be on the other side where, okay, for us, a lot of practices involve it's a group of docs, right? A group of radiologists or whatever the specialty might be. Let's say it's a group of ENTs or urologists. What is their take on it? Like, oh, well, Dr. Fritts, he's only coming in, once, 1 week every so often, how we're going to cater to him. Like, what's this about? Right.
Yeah.
So have you seen people have challenges with that side of things? Not to say that it's all kind of theoretical. Not that I've heard of that.
No, I know what you mean. I
think people would be afraid of that. You know what I mean?
I know what you mean. And to be honest with you, I was a little, when I decided that I'm going to accept the role and I'm going to resign from my substantive post in Guy's and Zombies, I was a little bit worried how my colleagues are going to see this.
Yeah.
And to be honest, I was a little bit sad as well, because I have lovely colleagues and they're amazing people. It's a great hospital and a great team of people. So I didn't want them to feel like they have done something wrong, or because it was nothing like that. And when I announced that I'm leaving, I have to say that everybody was so supportive and they were also very nice about this. And I think that shows that you are working with a nice group of people, because I think that's the right reaction that someone should have when someone, is going somewhere else to do something a little bit different. And everybody was very supportive. And I have to say, I was very lucky with that. I got all the support from my clinical lead back then, Thanasis, who, was amazing helping me out. They were very kind and they offered me this honorary contract. The clinical director was also very nice. And, we could see that, okay, we sat down and we're like, okay, let's see now how we can make this a useful partnership moving forward. I mean, what can you bring to the trust, to the hospital in that 1 day a week? Or what can you continue doing? And, we had a frank conversation about, okay, you're not going to be able to do the things that you used to do in the past, but what are the things that you can still do? And, we identified those areas that I could still contribute and I could still support the service. Because I don't think there is a hospital that in Europe, US, or in the world that would say no to an extra pair of hands, right? I mean,
yeah, you'd be surprised. I mean, like, at least not in. Look, there's definitely a need out there, right? And you and I talked about this when we saw each other at Cersei. It's like there's definitely a need for docs. It might be more in a rural setting or a smaller city, but like there are certain places where there's a lot of competition. There's turf wars where they're not just going to give a radiologist or an IR privileges, but there's tons of locums opportunities because we have these issues with people leaving, right? So yeah, that was what I was going to comment on, is like, there's plenty of opportunities. So even if your group poo-poos your transition and it's like, well, good luck, but we don't want to see you anymore, there's plenty of opportunities for clinical work, wouldn't you say?
Oh, absolutely. Absolutely. And, as I said, I was lucky and I didn't have to face that issue. I'm sure that, in certain environments and it's maybe some hospitals, you might get that reaction, but that's definitely the wrong reaction. As I said, you have to also be a little bit realistic and you also have to make some, try to help them out a little bit if you want. So for example, what I did, I said that, look, guys, I can do some of these sessions pro bono. So you don't have to pay me. So just as I want to give something back to you, I want to give something back to the trust. So I'm going to do some of these sessions for free. And, I mean, I didn't have to say that, I didn't have to do that, but I felt like, okay, that's something that I can afford to do it. And I was more than happy to do it simply because they were so nice to me. But, as you said, I think it all comes down to, having this discussion and making sure that you're transparent, you're honest with your hospital, and just set the expectations. Tell them, okay, what I can do for you, and how I can help you, and why you should carry on doing this. As you said, I'm very aware that in some environments this might not be possible. That you might get, a negative reaction. But I think that, in a world where there are not enough interventional radiologists or radiologists, if one hospital doesn't want to keep you for a day, then I'm sure you're going to find 5 more, 10 others that they're going to be more than happy to employ you and give you an opportunity.
Yeah, I think that's well said. And for anybody who might be hesitant for those reasons, I feel like we did a good job of kind of laying out both sides of it, the options that are there, that, finding those supporters are key. Like when you're going to make a big move like that, just find people who get what you're trying to do, can help support you, so that if you want to work that 1 day of the week, whether it be, sometimes you have to travel a little bit for it, right? But those opportunities do exist. Do you find that you have more time and opportunities for things like medical missions? I know you do some work with Road to IR. Has the transition helped free up time or energy for fun stuff like that?
My work-life balance obviously have changed a lot, and that's mostly because I mostly work virtually. I have to do quite a lot of traveling. That's true. So this also has changed. But the good thing is I like traveling, so I don't mind that aspect of the job. But when it comes to the day-to-day working, you're more flexible to do things. So, I mean, I'm not really working 9 to 5 or 8 to 5, or it depends on every day what I have. So when I have my meetings, when I have something that a task that needs to be done, a presentation, or when I need to submit a report for something, So some days I might have to work a little bit longer. Sometimes I might have to work a little bit less. I mean, this flexibility is quite unique, I have to say, and it's something that, as physicians, we have never really experienced that. And for me, it was really amazing to see that. Oh, okay, I can actually go for a haircut today at midday. I had never been for a haircut at midday because you're in the hospital. You can't go. It's like, or you cannot have your stuff delivered at your home because you're at the hospital, or you cannot go for lunch or a lunch break, or because you're at the hospital all the time. So these are the little things that change with your routine when you are working in a hybrid model and in a virtual model. Of course, traveling means that you might be a little bit, away from home a little bit more. For some people, this can be a problem. For example, in October and November, I was in a plane almost every other week. I was waking up every week. I didn't know where I was, but I didn't mind that. I know that if you do this a lot, and if you do this, and as you grow older, then it might wear you down a little bit, and you might not find this as funny or as fun anymore. But it's a sacrifice, if you want, that you have to make. That okay, you have a little bit more of a flexible routine, but you have to travel. Obviously, not all jobs are like that. Okay, so if you're in a global role, you're gonna have to travel more. If you're in a local role, you might have to travel more nationally or regionally. You don't have to travel that much. So again, there are so many different opportunities at different levels that you can always find something that fits your the life that you want to have, if you want. But for me, that wasn't the motivation. The motivation wasn't to make my life easier. Now, if my life has become easier, that's another thing. Maybe, I think it has, because you don't have the on-calls, you don't have to worry about the weekends, and obviously for most people, I think that will be a bonus. That will be a benefit. If you can have all. Before I started in Bayer, I can't remember having more than 3 weekends off or something, or it was always something happening. So yeah, our life is tough at the hospital. There's no doubt about that. And the people don't appreciate that when they're not working in the hospital. They can never understand that. But the moment, you leave that hospital environment, you start doing something else, you understand how the people who work at the hospital, how, important their job is, how difficult their job is. Yeah, it's, and I have so much respect for the people that, stay in the hospital and do 100% clinical work. It's because it's simply so demanding and so, difficult, especially under the current environment where you have under the budgets are always going down, and so on.
Yeah. I think that's the big value add too, is the autonomy that you get, right?
Yeah.
You have control over your workday. Like you're saying, hey, you know what?
You have more control. Definitely have more control. Yeah.
Yeah. And I think that's something that you're right. Like it's pounded into us. It's hardwired into us after years of training that
you have to do 8 to 8. That if you don't do 12 hours, certainly that you are
you're lazy or something.
You're a lazy person. Yeah.
Yeah. And it's just so when you go to get that haircut in the middle afternoon, you're like, this doesn't feel right. This is weird.
Yeah.
And that's unfortunate because, friends of mine who've been, in the outside, the rest of the world, that's normal life for them. And so that to me, I think was one of the big, even though I'll work till midnight at night on BackTable, I know that I'm going to put the hours in to find success in whatever I'm doing, but that might not mean being in the hospital during that time. Right. I feel like that's the hardest thing. And watching some of my friends who've made transitions, it's just hard to feel like you shouldn't be in the hospital all the time because that's just what we're used to. You almost feel guilty for it, right?
Yeah. But we shouldn't feel guilty. And
no.
And okay, as I said, I might go and have a haircut in the afternoon, but then, today, for example, I'm going to finish my day in 2-3 hours from now. I mean, because I have meetings, I have things that I need to do. So in a way, you are responsible. So this doesn't mean that you work less, but you work in a way that you want to work whenever this is possible. And of course, there are elements of this job that as physicians we find a little bit hard to adapt to. And for example, many meetings. I mean, some doctors don't, they hate being in a meeting room, just talking and listening. But this is an essential part of the job because, you have to collaborate with other people. We're talking about big projects that have many, many moving parts all over the world with huge budgets. You have to make sure that everybody's on board, and that's why we have so many smart people on the team. You have to take their inputs, and you have to coordinate all these things. Or that's my role anyway. So it is hard work in a way. It's a more, if you want, it's a more. You do a lot of planning as well. So you make decisions for what's going to happen in 5 years from now. So you might not see exactly what's happening now. It's not like in medicine where you do a port, you do a stent, and you see the results immediately. You have to be patient. And some people find this a little bit frustrating that you are, talking about things that might happen in 2, 3, 4, 5 years from now. So that's a bit of a difference that I've seen, for example, from my previous life to what I'm doing now.
Yeah, it's not that instant gratification that you get in medicine,
exactly.
which does, scratch an itch. I mean, that's the nice thing about when I do my locums weeks. It's like, I knocked out 60 cases this week, and now I feel like I accomplished something. Yeah. Versus, that was going to be one of my questions, because I imagine when you're traveling a lot, it's all meetings. Do you ever get meeting fatigue where you're just like, I cannot have another meeting, or my head's going to explode?
Yeah, you get tired.
Yeah. It's exhausting, right?
You do get tired, and you might not be standing in a room wearing a 10-kilo lead coat, but it is, intellectually challenging sometimes.
Yeah.
And
challenging,
and you always have to keep in mind why you're doing this, and because it's very easy to forget why you're in that meeting and what's the bigger picture. But I think what helps me is to try to remember that we're doing this because we're trying to develop a drug that's going to save, thousands or millions of lives at some point. And for me, that was a big driver for, joining a company like Bayer. Because, I was a little bit frustrated working on, little projects with trying to raise 100K for 20, 50, 60 patients. And the impact you have is small. I mean, you have to start from somewhere, obviously. But what I really enjoy now is that, I enjoy the bigger picture, that I can see that if everything that we're doing now, all these meetings and all this work that we're doing, if that works, then we can deliver a drug that obviously is going to be good for the company, but it's going to be great for many patients. And we have seen that. We have seen many examples like that, drugs have been developed that change the lives of many people. And for me, that's what I try to keep in mind, that we're not here just for another meeting. That's a small part, that's a small piece of a bigger puzzle that we're trying to put together. Obviously, this approach not always works. I mean, sometimes I do get really tired. But you have to try to remember that. You have to try to remember why you're doing that.
Yeah. Well, Greg, I think that's a great place to end it. We're coming up on the hour, and I've really enjoyed our conversation and talking about your transition. And I think you gave some solid advice for anybody who's considering this. Whether it be a complete transition like something that you made, or just consulting work. I think what you've hammered home is really like you got to be able to provide value for the industry, whether it be pharmaceutical or device. I think most people are probably from our world are going to device, but it's common ground for either way. But any final words before we finish up, Greg?
No, I mean the only last thing I wanted to say is that at the end of the day, if you think about this, the medical device industry, the pharmaceutical industry, And we as doctors, at the end, we're all trying to do the same thing. We're trying to help patients. And we have to be happy to help them out as well. Either that's going to be in a consulting role, either it's going to be in an educational teaching role, or it's going to be in a full-time capacity like I'm doing myself. We shouldn't see these opportunities. We should see these as opportunities to contribute into the bigger picture, which is advancing healthcare, advancing medical standards. And I don't think we should be afraid. As I said, it's not for everybody, but I think that you're doing a great job in raising awareness around these things and removing the stigma around these kind of roles. And obviously, if there are people out there who would like to find out more about what I do, I know it's very hard to, talk about everything in an hour. I will be more than happy to, just reach out to me on LinkedIn or Twitter, and I can answer questions. Or, at the next conference, SIR series, I would be more than happy to chat over a coffee.
Yeah, that'd be great. Exactly. I'm sure there's so much more, whether it's somebody who's just starting to look or somebody who's maybe has a job on the table and they're negotiating. I'm sure you could provide answers to many of those questions, having gone through it. So, well, Greg, thank you so much. I'm looking forward to. Are you going to be at Cersei? Or not Cersei? Sorry, are you going to be at SIR?
I'll probably be at SIR.
Okay.
So hopefully I'll see some of my American friends there, and hopefully you are.
Yeah. I'm going to go. I just booked my ticket to Phoenix, so I'm excited to see a lot of people there. I'll let you know when I'm up in London as well.
Yeah, absolutely. That'll be great.
And feel free to come down to Paris, man. All right, bud. Thank you so much.